Dr. Jurina, you're a specialist in European veterinary neurology. You are also the co-owner of the Tierklinik Haar, a small animal second opinion clinic close to Munich. Your focus is on neurology and neurosurgery as well as advanced imaging techniques. You're also responsible for MRI and CT. Could you briefly sum up the milestones of your professional career?
Well, I started studying veterinary medicine in the vet school of Berlin and spent some years at university where I was responsible for neurology and also for the MRI. And in 2003, I decided with two other colleagues to settle one of, in the meantime, largest referral animal hospitals in Germany.
And how long have you been collaborating with ESA-Orte?
I think we started a collaboration when we started a clinic since 2003.
Okay, great. And how effectively does ESA-Orte technology meet your needs?
Well, in the beginning I was quite skeptic, but when I saw the possibilities, especially of the VetMR, I was convinced that it's defining our needs. So it was really pleasant to have the collaboration with ESA-Orte.
Okay, and how do you see ESA-Orte in the international scenario for this kind of application and more generally speaking in the MRI world?
Yeah. Well, I think for vets they found a niche market that they are replacing in perfect manner. In comparison to different companies, I see a very great dedication to veterinary medicine, and that's the most important part in dealing with this high sophisticated technology.
Okay, great. And how do you see the contribution given by MRI compared to CT in your daily practice?
Well, being a neurologist, I'm reliant on MRI in most of the cases we are dealing with. So we have a large caseload. We examine about 800 cases per year in MRI. We also have a CT facility in our clinic available, but being a neurologist, I rely on an MRI.
And in your opinion, what are the most important trends in vet imaging today?
Well, I think the most important trends is the fusion of some techniques, like the fusion of ultrasound in real time in combination with CT and MRI, and giving a perspective into future for neurologists, it would be very, very important to have a modality that easily makes it easy to get biopsies of the brain or of lesions we recognize in MRI. So this would be my future perspective, to find a modality where we can combine the imaging possibilities also with the biopsy to reach a definite diagnosis and perhaps to induce some treatment as well.
I see. And in your clinical experience, what would you say are the advantages of vet grande in comparison with vet MR?
Well, I honestly have to confess, vet MR is not comparable to vet grande because we have made such an improvement with the use of vet grande, and I am ashamed to say that I thought I would do MRI using the vet MR 10 years ago, but right now when I deal with the vet grande, I see it was nothing comparable. So the improvement is the quality of the images, it's the time we are saving, and this is the most important part for offering clients a very dedicated modality, which they have to pay for it. So it's a big improvement having the vet grande right now in our hospital.
I see. And lastly, do you have any suggestions for the future?
For the future, I think that dedication for ESA-Orte should be kept like they do it right now. That would be more than happy.
Great. Okay, thanks so much, Dr. Jurina. It was nice talking to you.